All right, welcome, Dr. Bayo Curry-Winchell. So for those who are just joining us today, Dr. Bayo Curry-Winchell is a board-certified practicing family physician based in Reno. She serves as a regional clinical director for Carbon Health and medical director for St. Mary's Medical Group. She's also a member of the governor's medical advisory team and Reno Mayor's task force on COVID-19. She's joining us today to kind of answer some questions about COVID-19, sort of give us a lay of the land and a few other things. So welcome to Q&A.
Thank you for having me, Tabitha. I'm excited to be here.
We're really excited to have you on. And I know that we have you for just an hour, so I kind of want to launch in. We've seen a dip in COVID-19 cases here in Nevada in both the North and the South. Can you tell me a little bit about what might be causing those case decreases and explain that a little bit?
Well, first, I just want to say I am very excited that we have seen a decrease in cases. So that has been just wonderful news. I know just felt throughout our state. And so there could be a blend of it. Number one, I think vaccinations are definitely a part of that piece. We do have, more people vaccinated than we did before. And so that really is a piece in the puzzle of why cases have gone down. And so when you also look at the different variants and other factors that present, those cases can make a difference as far as infectivity, transmissibility, and so forth. But I would say vaccination has been number one.
And so, we've seen a lot of vaccinations, and we're also seeing that in various places, this kind of rise in the BA.2 variant. What do we know about that? And do we expect that we'll see a wave here in Nevada in the future if we're not seeing it now?
So we do know that the BA.2 variant, which is a subvariant, definitely has a higher level of infectivity, meaning it is transmissible more. But the good part, which I always like to kind of shine a light on the positivity piece, is it doesn't appear to cause severe disease or hospitalization. Now, I say that with guardrails because, every person is different when they experience this disease. And so when we state mild to moderate symptoms, that could still include, being bedbound for a couple of days, nausea, vomiting, and a severe cough and fatigue. And that can be debilitating for your everyday life. And so although it's not a severe disease, we have to be mindful that it can still really impact your life. And there's still the possibility, especially if you are unvaccinated or if you have not received your booster and you're vaccinated, that you could have symptoms that are worse than, what people who have been vaccinated and boosted. So it's just really important to take that into consideration.
And as part of the reason that that we're seeing kind of maybe less severe symptoms than with previous strains, is that because the virus is mutating? Like, what is kind of the science behind that?
Well, I always like to start with viruses naturally mutate. So what we're seeing is a natural course that viruses follow through. And so as they tend to evolve into different types of variants and so forth, they can present differently. So sometimes that new wave could be more severe, such as, what we saw with the Delta and so forth, or sometimes it actually may be less severe, but that level of transmissibility can build, meaning that ability to infect can actually become elevated. And so that can be a concern when you look at disease rates as well as infectivity when you speak about variants.
And so we'll get to some guidance recommendations and what people should maybe be doing to protect themselves. But first, I want to focus a little bit on some of the shifts in data reporting that we've seen, right? We're seeing a lifting of mask requirements in airports. We're seeing, kind of changes from how public health officials are talking about this. What phase of the pandemic would you say are we in right now?
At this point, I would really say we are endemic. This is a virus that is with us and that will remain with us. And I think it's important to, realize we can't necessarily control it, but we can adapt as needed. And so when you take that into consideration, such as if there's a high number of case rates, or if there's a new variant that really is causing severe disease or even mild to moderate, like I mentioned, really flexing in response to those variants as needed. But at this point, the virus is, within, it's just a part of us moving forward. And that's my own personal opinion.
And so I know that a lot of people, myself included, we like to watch the data on COVID. Is the data we're getting, is it accurate anymore, considering kind of the wide availability of at-home testing, especially when we're looking at case numbers? What metrics should maybe we be watching right now to kind of keep track of the ebb and flow?
It's really hard because we do have, which is a good thing, we have at-home testing, which was a wonderful add for people to be able to find out or, confirm or if they are positive for COVID. So that's just been a wonderful element to resources in our healthcare, especially in response to COVID. But when you take into consideration that at-home testing is available, that can skew the amount of results that are actually coming through the system to really be able to give a accurate number of, the positivity rate and so forth. One thing that is helpful, and I don't believe you should hang your hat on it completely, is looking at hospitalization rates, because I think that is a good indicator as well. But, we still can't forget those mild to moderate symptoms are still, debilitating, as well as there's still a possibility of transmission. So there's many elements. It's multifaceted when it comes to really looking at the numbers and where to really kind of put your North Star on as far as guidance.
Right. And do you think it would be practical to have people report at-home results to government officials, or do you think that we're kind of beyond that right now, as part of that mix of things to watch?
At this point, I really think it's a personal decision, for people to decide if they want to report that. It is helpful so we can really account for the number of cases. But of course, it's also important for people to feel comfortable in doing that. So I think that's a personal decision that people have to make for themselves as far as, reporting their positivity rates. But it can be helpful just to kind of track how the numbers, especially in certain counties and states and so forth.
And then kind of pivoting a little bit to talking about masks, right? We've seen a lot of sort of different things with masks, and then obviously the lifting of the mask with airports. What are the risk factors specific to air travel? Should people still be wearing masks on airplanes? What are your thoughts on that?
So, we do know that masks do help. Now, there's different levels of protection when we talk about masks, whether it's a traditional surgical mask or a K95 or a true N95. And so I think people have to decide based on, the event they're attending, a restaurant, a family gathering. I think that choice of making, should I wear a mask or not, needs to be kind of addressed within a personal decision. And so one piece of advice I have is, if you are going to have a family event and you are concerned about possibly transmitting COVID-19, one thing you can do is get tested 3 to 4 days before and the day of the event. And so that's something that could help, definitely before an event and possibly decrease a transmission happening in your family or with your friends or loved ones. So again, it's just kind of making that decision based on where you're going, what you're going to do, and how you feel the overall risk is.
And then, we all received kind of those testing from the government. How long do those last? Should I be, just keep them in my drawer until I'm ready to use one? Or is there an expiration date? What would you tell people about those?
I would, with an expiration date, I would follow that guideline. If more information comes out that it is extended, that it's longer, then that would be fine. But at this point, I would definitely adhere to the recommended expiration date.
And then you mentioned hospitalizations. At the height of the Omicron wave, we saw increased hospitalizations, stress on Nevada's hospital infrastructure. What are we seeing right now?
So right now, and fortunately in Nevada, and we are such an amazing state, just in general. But I'm grateful that our hospitalization rate is not high, and so, but it's still something to be vigilant. And it's important that I just give a shout out to all of the amazing healthcare professionals who have, even before the pandemic, provided high quality care, and throughout this pandemic have responded and just done their best through so many different challenges. I think that really speaks to our workforce employment that we have, especially within the healthcare system. So grateful for my colleagues.
And I know they were really worried about a shortage of healthcare workers. Is that still a fear within the industry right now?
It is. We had a shortage even before the pandemic. And so, I would love to have or see additional efforts put forward in recruitment of all healthcare professionals. And, when I think of the physician shortage, particularly, that is something that, again, needs more physicians and more diversity in all healthcare professionals. But in Northern Nevada, it's just something that we have continued to struggle with. And so I'm hopeful that we can increase the amount of healthcare professionals we have in our state, because when you really look at the increase in population that we now have, we need to be able to respond accordingly, whether there's another pandemic, whether, just disease rates and so forth. We want to be able to have the resources available to provide, ongoing care.
And as COVID has become present in our population, we know that we're going to see sort of rise in case numbers. What is the fear from professionals? Is it that, do we have enough infrastructure for people? Do we have enough hospital beds if we need them? What other worries do you have surrounding maybe the hospital care infrastructure?
I think it's multifaceted. I mean, infrastructure is huge. You need to make sure you have that framework available to really meet the demand of the population. And that involves all the inner workings of having physicians, nurses, CNAs, respiratory therapists, all of those just very essential pieces to running an infrastructure need to happen. So that is a worry that, I think we all have, especially healthcare professionals in Nevada, to make sure that we have the amount of people to be able to meet the demand of the increase in population. So it's something that I'm hopeful that our state can continue to work on.
Right. And, you talked about vaccinations. How essential are vaccinations to combating COVID-19? Do you have fears about hesitancy toward other vaccinations? What would it mean if people choose not to get vaccinated? I realize I just threw about 3 questions at you, but.
Well, I think vaccinations are critical. And, I like to take a look back. When you look at history, they were so important in fighting diseases. And when we look at smallpox, polio, measles, and how they helped decrease the prevalence across the country because they were able to really prevent disease, or at least decrease the severity of disease, is important. And I think when you take a step back and you look at that history of vaccines, it really reinforces the importance, as well as represents how helpful they have been in fighting this pandemic. So, I think it's been a huge, important piece in us getting to where we have, where we've achieved this level of decreasing cases. It's definitely a part of it.
And then we know that there was a lot of funding that was directed toward kind of COVID tests, vaccines. What are you seeing now that some of that funding has sort of, hasn't been replenished?
Well, I'm going to go back to your other question, Tabitha, because I feel like it kind of is a combo. And you had mentioned mistrust. And so that was present even before the pandemic when you talk about public health. And it's important to acknowledge that. And there are certain, groups that have really experienced terrible things when it comes to public health. And I think it was really illuminated when we rolled out, the vaccine and so forth. So there is a need for ongoing health literacy and understanding of what has happened in the past, how you acknowledge it, and how you provide new information moving forward, because that's how you're going to build trust. That's how you're going to increase engagement and even just thinking about getting vaccinated and being open to answering people's questions. I think that is a huge thing that we have learned from the pandemic. And I hope, we continue to keep that narrative going, because even if you agree to disagree, that's okay. But everyone should be able to have, their questions answered, and then really provide credible information to support it. So that mistrust is still present throughout. And it's something that we have to continue to acknowledge and make sure that we consider it with each disease, issue, or anything that presents itself.
And sort of along the same line, we've seen healthcare costs can be prohibitive for folks, right? If you're underinsured or you aren't insured, sometimes getting a vaccine is difficult, paying for tests. What are you worried about maybe as we move forward and there isn't the supplemental financial support for getting some of these vaccines and these tests?
I worry that, people will not actually seek out testing because they can't afford it. And, that is something that we have to really invest in improving access and the ability to find out your health status and do something about it. So I worry about that, especially with the fact that if there's this financial barrier, people will stay at home. They might actually have symptoms that lead to a need for higher level of care, such as hospitalization, and they may not seek it. And it's because of, cost. And that is, something that you would never want your friend, your family, or any person to experience just because they didn't have enough money to be able to, seek care. So it's something that, again, there's so many different elements that we need to really be mindful of.
And what options are there that you maybe know of or could point people to who can't afford those tests and vaccines, including those who are uninsured?
So there are several things. Seeking out, there's lots of resources, of course, but it's hard to, really find out where to go. And so
right.
I think like FQHCs, federally qualified healthcare centers, such as, Community Health Alliance, Access to Care, there's so many different places, the public health system and so forth, that can really help you find those resources, or at least help you get tested if you need to. So, and that's another thing, we have to really increase and diversify the different ways we provide those resources. So people know not everyone has internet, not everyone has television. So finding different ways to provide those resources, I think, is crucial.
And then, what have you kind of seen work from your experience? Is it going door to door? Is it, face to face, a mixture of things when kind of approaching that problem?
So, I would say when it comes to mistrust, if I go back to that, I would say really finding trusted messengers. I think that is key. I am so grateful that I had the opportunity to pair up with several doctors, one being Dr. Pasternak, who's just fantastic, and also Dr. Morgan and Pastor Deshawn, and Dr. Angie Taylor. And we realized the importance of being able to to deliver health information in a trusted space. And we know so many people trust their pastors and their priests. And so being able to come together, provide that health information to them, and then they were able to share it, with their congregation and communities and so forth, which was a lovely way to deliver the information with just an openness and without any sort of, secondary, what am I thinking of? Gain, without a secondary gain. And then that led to an invitation for us to speak to those community members and congregation, and then providing a vaccine clinic shortly after. And I think that those steps of access, trust, and really providing the health information is key. And that needs to happen outside of COVID-19, whether it's hypertension, diabetes, any sort of illness. Those three parameters can make a difference. And it doesn't mean making a difference for necessarily having to do one thing, get vaccinated or something like that, but it provides a person the opportunity to hear the information and then digest and make the best decision for themselves and their family.
Absolutely. And kind of along similar lines, we saw the CDC issue additional guidance for immunocompromised people, those over the age of 50, to get an additional booster shot. Have you heard about additional booster shots for others that fall outside of those categories?
So science is always evolving. There's lots of studies and trials and also in different countries where they are, really marinating on the possibility of a fourth booster or have really moved forward with that. So, that's something that's still in the works. And I just look forward to really fighting out the guidance and also digging a little deeper to make sure that guidance is something that I agree with. And I'm sure I will, because we do know that the vaccine and boosters have really allowed our bodies to continue to fight this virus.
Do you expect kind of a COVID-19 vaccine to become part of, say, like the flu shot that we get every year? Or what do you kind of think will happen in the future?
So I do. I expect that, especially with it being endemic, that this will be something that we will continue to offer. Of course, things can change based on variants and so forth, but we do know, especially when to bring up the topic of the flu shot, how helpful that has been for so many years. And often people state, well, the flu isn't that bad. Now, maybe not for you, but every person is different. And so having the opportunity to possibly not get it or decrease your symptoms, I think is a gift, and a gift that really allows you to be able to give your best shot in fighting an illness.
And do we have any updates on COVID-19 vaccines for children under 5? I know that's a big question for parents right now, especially, school's underway, activities are going on. Things are sort of returning to kind of usual.
So one thing that I really am proud of, just our overall healthcare system, government, really government oversight, is they have identified some issues or some things that didn't really meet what they wanted it to do for pediatrics. And so they're really taking time to make sure that it is an appropriate dose, that it will provide a level of protection, because, our children are our most vulnerable population. And we want to make sure, just like with other vaccines that we have given our children, that it's appropriate, that it's the right dose, that it will provide protection. So, it's, again, there's some studies and there's some thoughts out there, but I don't like to speak about that until we really have some true, information about what's to come.
And as we wait on those vaccines for children under 5, what can parents do right now to make sure that their kids do stay safe and maybe don't catch COVID?
So, I go back to those tips of if you are going to attend, an event or have something that you or vacation and so forth, getting tested, I think is a big help, especially before the event and the day of. And then also wearing a mask as you feel appropriate based on your environment. I think that can be very helpful for children. We also want to think about those that are immunocompromised, and meaning you have a weaker immune system, and utilizing those efforts of testing and wearing a mask can be very helpful. And on the flip side, I also like to share, if you have symptoms, if you're not feeling well, do your due diligence and not attend an event, because you also don't want to pass, COVID-19 or something else to others as you go to an event.
Right. We saw the pandemic, and we touched on this a little bit, take kind of a disproportionate toll on historically marginalized and lower income communities. What lessons do you think public health officials should take away from this? And how might the pandemic have shaped the way that health officials reach out to these historically underrepresented and marginalized communities in the future? I know you mentioned finding kind of point people within the community, using them as a way. What do you want people to kind of remember from this?
That not everyone receives health information the same way. We have to find people or meet people where they are, and really be thoughtful in how we roll out different measures, whether it's, testing or vaccinations. How can they get there? Is there access beyond a car? Are they able to walk there? What elements are there to really allow full access to care? And I think that really will help move the needle when we talk about marginalized communities and the underserved. And when it comes to the BIPOC community, again, I go back to acknowledgement of, historical mistrust, and really understanding that having more doctors of color, more doctors of different genders and different elements to be available to answer people's questions, to feel that rapport and connection, which is so essential even before you deliver that healthcare information. And so I think that is a piece that I hope moving forward that the government actually, really invest in, because that's going to help people trust more and make the best informed decision for themselves and their family.
And we've talked about mistrust a lot, especially a little bit earlier on, but I think that, there's a lot of mistrust between the medical community and historically marginalized communities. Can you touch on that a little bit and explain, just for people watching, what's kind of behind that?
So, often people they may not recall or remember or are lacking full details of the Tuskegee, the syphilis study, and how the government tested on African-American men. And at that time, syphilis was very prevalent, and Black men signed up in hopes of helping the government by, using themselves as truly a sample to help. Unfortunately, a treatment of penicillin was available, and it was not given to these male African-American men. Instead, they used the study to observe the terrible impacts that syphilis has on the body. And so they took notes and learned a lot from the disease. And it was at the expense of these men. And people often say, oh, that was a long time ago. Nobody remembers that. But it is still something that people remember, and they pass it down, through verbal stories to their children and grandchildren. And that is part of that mistrust that is interwoven into just people of their thoughts towards the government. And so that's one example. And there are many, and by no means by me just speaking about African Americans, I don't want to discount all of the other,
Right.
issues that have happened to other races and genders and so forth. And that's just one example of many.
Yeah, one example of a very deeply rooted historic sort of targeting of communities of color within these frameworks. And then we've been getting a couple of reader questions that I want to turn to right now. One focused on long COVID. Can you tell me what's tricky about diagnosing long COVID, and why do we not know that much about continuing symptoms that we're seeing?
So, this virus is really, it's just different in every person. You'll hear some people that stated, I just had a cough and cold and I was feeling better shortly after. And others, unfortunately, were sick for 2 weeks, a month, and then symptoms resolved. And others have had ongoing symptoms. And so long COVID really speaks to so many different symptoms, whether it's, a shortness of breath, difficulty just breathing, shortness of breath, and a chronic cough. Fatigue has been a big, a common theme that people are seeing with long COVID. And so those symptoms can be quite debilitating. You can imagine if you're at work and if you have this kind of ongoing cough or you are severely fatigued, it really disrupts your ability to be able to get your work done or be able to be, productive just in general. So those are some of the things that we are seeing with long COVID. So they are, of course, working hard to find different ways to at least, either support, decrease those symptoms, but at this time, there isn't necessarily a cure for long COVID. And it's something that we have to continue to keep a close eye on in hopes that we can at least find some way to, help these patients who are just suffering from debilitating illness that's just been ongoing.
And I know that there's research that's going on right now. How long does it usually take for a research study to get going and to really give us some insight into maybe long COVID and other things that we're seeing as a result of COVID-19?
So it depends, it depends upon what the study is focused on, meaning what symptomology, and then the sample size. Often, if it's a good study, they really want to make sure that they have a good number of people involved in the study. And then there's also other factors, making sure there isn't any biases, there isn't any other kind of confounders that could decrease the accuracy of the study. So it's hard to put a timeline just because every study is different. And sometimes they experience things that pivot that timeline. And for what it's worth, I think when you know that, it helps kind of provide more credibility to those studies.
Right. And then thinking about the virus, vaccines, the pandemic, are there any myths that you want to dispel or that we might not have talked about that you think are kind of essential for readers, or in this case, viewers, to know?
So, one myth is that the vaccine will cause you to actually contract COVID. And I think that's an important thing. And that is, something I commonly hear, like, oh, if I get the vaccine, I will get COVID, as well as I got the shot and I got sick, so I had COVID, or I don't want to get vaccinated because I don't want to feel ill. And so I like to share kind of what is happening when you get the vaccine. So I correlate it to like a recipe. So when you receive the vaccine, your body is really taking in, the possible examples of what, COVID-19 really portrays. And so by getting the vaccine, your body now has an example of how it works and how to fight it. And so when you do have those symptoms, such as, a fever or body aches, it's your body's way of building up and fighting COVID-19 as if it was to come into contact. that rehearsal, that kind of, presentation or attack is what your body is gearing up for if it was to ever come into contact. And so I think that's important to know, because often when you're not feeling well after receiving a vaccine and you're like, why did I do this to myself? I didn't want to be sick. When you know why your body is responding in that way, it's helpful to kind of understand the reasoning and also feel better about what is going on as far as symptoms.
So if I get really sick from getting the vaccine, which I did, I've had a big fever, was miserable for a couple of days. Is that just basically a mild form of maybe what would have happened if I had gotten the actual virus without the vaccine, or is it different?
It's different. So, it's more of just your body being able to have that example in front of itself to kind of gear up your immune system. So if it was to ever come into contact of the full virus, it would be able to respond accordingly. So it's building up your immune system, really being able to help you fight it if you were to ever come into contact with it. But often people are like, I'm sick from COVID because I got the shot. Now, that being said, no scenario is 100% perfect. And I say that you could always end up picking up a virus, not just COVID, the flu, at the same time that you happen to get vaccinated. So those things can happen. And so it's just important to seek out your healthcare professional and make sure you get checked out.
And the vaccines don't actually contain the live virus, right?
That is correct.
Right. Because it's a copy of it, or can you explain that just a little bit?
So it's not the live vaccine. It's that recipe card. It's that kind of small example of it. And so when it's introduced into your body now has, kind of a blueprint to what it could actually be exposed to. And it's able to fight and kind of get itself ready if it was ever to come into contact with it. Right.
And, when we're thinking about, we've gotten some questions from readers about masks and how they actually work. Can you just give a brief explanation of what a mask does and does not do?
Yes. So, a mask, of course, as we talk and we communicate with people, of course, there's respiratory, exchanges and so forth. And so the mask actually helps decrease that. Now, that being said, nothing is 100%, and that's important to mention. But there is a decrease in the amount of exchange by wearing a mask. Now you have a higher level of protection with like an N95 versus, a surgical mask. And so anytime you're able to really be able to prevent that transmission, it can decrease the amount of viral load or the amount of, exposure that you could get without it. So that can help, number one, with infectivity rate, as well as hopefully decrease your chance of contracting the virus.
And then how are you personally thinking about the virus and navigating the future of this pandemic?
So personally, just like all of us, we have been through so much. And for me, it's just really doing the best that I can for my family and my patients. That is key for me. And I think providing grace for people who may not agree with you. I think that level of kindness and understanding is the way I am really moving forward, with having to face this pandemic and of course the ongoing surges. So that really provides me peace, where I'm just doing the best that I can every day to provide the best care and really advocate for health inequities and disparities and trying to close, that gap of prevalence of different diseases, even outside of COVID-19.
And one of the things that I've really noticed is some of these shifting and changing guidelines, right? As, we learn more about the virus, this happens, or we adjust this kind of metric. Can you, from somebody not in the medical community, it sometimes can seem a little jarring. What's your perspective as a medical professional as things have evolved and changed with these recommendations?
So, as they continue to shift, and we're all in this where we're trying to, go with the latest guidance, I think that it's important to understand that science is, it's always changing, and we find out new things as we go. And when you look back at different diseases and treatments, it's through science, and it was through just different reiterations of different things that are coming through. And so I think for your family, the best thing you can do is just make that personal decision that works for you, and take that guidance into consideration. That's all we can do, but just know that those recommendations are truly embedded in trying to protect the entire United States. Like, those things are really their intent is positive, and in hopes of trying to save lives, decrease infectivity, and really trying to get us back to, some sort of, normalcy.
And then looks like we got a question from a reader, and they're saying, how can a depleted healthcare infrastructure in Nevada adapt to handle an increase in complex caseloads?
I think number one is recruitment for that infrastructure, for those resources. And because that's the only way we can really meet the needs of this population. And it's not an easy answer. What I just answered is just one part of it. But really having committees and different meetings that can say, okay, this is what we need. This is how we're going to get it. And we are going to make sure that we diversify as well when we start moving forward with that recruitment. I think that is one step in the many steps that need to happen to be able to beef up our infrastructure within our healthcare systems.
And then another question that we just got was, how can, the public find out about trends of COVID in the state, specifically in Las Vegas, now that the state has stopped providing daily updates on the number of cases? And we touched on this a little bit at the beginning, but just kind of drilling into it.
I think, definitely the CDC and the public health, for Las Vegas and Northern Nevada, they are still continuing to, provide those numbers. So I think that's a lovely source of truth to kind of find out how things are moving as far as that trajectory in cases.
And, that movement from daily to weekly, what's the difference there that people should be aware of? Why does that change matter, or why doesn't it matter?
Well, it really depends, because it goes back to your question with at-home tests. There's still a lot of variability of knowing, the number of daily versus weekly, because we do have an outlier of cases that may not be really reported. And so then I still go back to, when people talk about the number of cases, really just day by day, looking at your risk factors, making those personal decisions of what you feel comfortable with engaging in. And so those numbers can be helpful, but also keeping a critical eye on this event that I'm going to. Am I okay if I don't am I fine not wearing a mask, which is fine? Just making those decisions, I think, is huge as we move forward.
And sort of taking on, this is the level of risk that I am accepting and that I am comfortable with in this environment.
I agree. That's exactly how, my personal feeling is that you should make that decision for yourself and your family. And then, be okay with that. Because I think that's another element that we have to really commit to. That whatever you decide to do, be okay with, that decision, and give each other. I go back to that word of grace. If you're at an event and someone is wearing a mask, providing a level of just kindness and respect, I think, is important, because you never know that person's story. Do they have someone at home that is immunocompromised? Do they have a child that they're worried about, getting sick or is immunocompromised? And so I think that's something as well, when we talk about case rates and what can we do, we can also provide each other kindness and understanding that this is your decision, this is my decision, and allow that to just be present through every single thing that you do.
And you mentioned watching hospitalizations. Is that watching like increases in hospitalizations? Is that watching like a certain caseload metric in hospitalizations? What are you talking about there when you're recommending people to kind of pay attention to that?
So it can be, caseloads as far as hospitalizations, but you have to also be, when we go back to the infrastructure situation. So if that hospital is reporting based on the number of beds or ratio of beds to nursing staff, that can really skew what your overall picture of the amount of cases that are in the hospital. So there's different elements to it, and it's not a one size fits all for every state and county, because it really depends upon that capacity that is within that hospital.
Right. And then one other question that we kind of got from a reader is, are all physicians current on how to treat COVID-related symptoms? Who should I be going to if I do, get COVID and feel like I need to see a professional?
So as far as every physician, I am not able to speak to that, but I appreciate the question. And I'll sprinkle this little part. We all have special pieces of our practice that we are very knowledgeable about. And I think that should be appreciated. And so finding that healthcare provider that you feel is at their best in the question or the disease or issue that you have, I think is important. And, researching online, and it's important to have a credible online source when you're researching that healthcare provider is crucial. Word of mouth can be also important as well, because it's not just the knowledge, it's also how do you connect with this person? Because I think the two parts have to be in sync, because you want to feel comfortable with whatever ailment or concern you have. You want to feel heard. You want to feel, and you should feel, not you want to, you should feel that your concern is important and that you are a part of the plan to address that issue moving forward. So that would be my recommendation. Of course, look people up, but also make sure it's a credible resource and, word of mouth. And when you get into the exam room, do you feel that this is the best person for you? I think that is just a huge part of making that right decision for any illness that you have.
We've heard sometimes about people going to doctors and not feeling heard within the medical industry. What would you recommend for somebody who maybe didn't click with their doctor or, is looking for some more specific advice that they couldn't get?
First part is being open and at least sharing that with your healthcare provider, because you never know, there might be a disconnect that could actually be fixed in that moment. So I think if you feel comfortable sharing that with that provider where there may be some missteps, I think is an important piece, because that person might be the right person, but there was just a difference in understanding or approach. And so start there. And, if it still is not what you feel is the best fit for your health, then, finding a different person and moving forward. But I think having that conversation is also important. And I'd like to share, when I was asked the question about, Nevada doctors, I can say, so grateful to work alongside such amazing healthcare professionals we have in this state. We have an amazing healthcare group that has responded and in so many different ways. And so I just want to give that shout out, because I'm so proud to be a part of such an amazing group here in Nevada.
Absolutely. And last question, because I know we're kind of we're getting right up on 6 o'clock here. Looking forward, what fears do you have thinking about kind of the future. And then the second part of that is then what are the hopes going? What things on the horizon do you see that do give you hope?
So as far as, fears, I will switch that into worries. I, worry that we won't continue to highlight the inequities and disparities present in healthcare, that the developments, the learnings that we gained from the pandemic, even with all of the, of course, death and terrible aspects of the pandemic, that we don't use those learnings to help move new initiatives, projects, provide better care moving forward. And that is a concern of mine because we need to be able to use those takeaways and make things better. And so that would be, one concern. I am hopeful that, we can start to have a return to our lives again in full capacity and be able to go to different places that we want to go to and hug our loved ones, which we're now doing. And I'm hopeful that that continues because that's part of health as well. Our connections with people, our physical connections with people, that is a part of mental and physical well-being. And so I'm hopeful we can continue on this trajectory, as well as I'm hopeful that if there is a possibility, of course, they don't want this of another surge or anything like that, that we can respond accordingly and really trust in the guidelines and trust in our efforts moving forward with whatever decision you choose for yourself and your family.
And do you think that this going through this pandemic, have we built up the infrastructure to handle something similar in the future?
We're not there yet, but we are working hard. And I told you I'm a hopeful person. So we have to keep the narrative going and continue to ask questions. And when I even said for patients to ask questions, I think healthcare systems continue to ask those questions. Are we doing this in a way that is really meeting the needs of our community? Are there things we can do better? Is there a group that really isn't really recognized in this initiative and rollout? And if it isn't, what can we do to improve it? So I hope we just keep, asking those questions and really putting a conscious effort to making change.
Well, on that note, thank you so much for giving us your time today. I really appreciate it. For those who joined us, thank you for watching. And if you do have questions, we have our COVID data page. We'll have a write-up from this interview, I think toward the end of the week. So thank you so much for joining us today.
Thank you for having me.